initially this little girl came in because there was some postural concerns around a little bit of scoliosis. And yeah, we found a tiny bit of scoliosis that was there. But when we started to look into, okay, why are we getting scoliosis, we found that there were a few primitive reflexes that were active, that were influencing the tone or the control of the muscles around the spine. One of which was the spinal galant reflex. So some kids who have that reflex, it makes the low back very sensitive, and it makes it hard for the brain to coordinate the muscles on the left and right side of your spine. So sometimes kids with that, they get bedwetting for longer than they should. Fortunately, you didn't know. Happens that. But when that reflex is there, it does make lateral muscle control inefficient. Another of the reflexes that we found, and this is something that we picked up on, is when we started to go into history in a bit more depth. We've got the scoliosis, but we also found that there was some motion sensitivity with long car trips, where a bit of nausea that would kick in. So there's a reflex called the ATNR reflex, which helps the brain to figure out the input that's coming in from the neck and the ears. But once the brain's learnt how to figure out those sensory inputs, that reflex should go away. But sometimes that reflex stays active, and it creates a little bit of a glitch with the sensory input that comes in from the ears and the neck. So what can start to happen is the brain can't figure out what's going on with rotational style movements, and then that can start to lead to motion sickness or motion sensitivities, because the brain's just getting confused by all the different signals coming in, either from the head of the neck with rotation or from the reflex that's still being a bit of a pest. So we've been doing some reflexes to try, some exercises to try and switch off those reflexes, especially the spinal galant and the ATNR. That's going well. We've also been doing some laser therapy over the right side of the brain to try and stimulate the area of the brain that's involved with movement sensory integration, and a few other tricks to try and get that right side of the brain a little bit stronger. Hope that makes sense.